and welcome. I'm Khushbu and you're watching Health Mantra. Today here in the studio we have Dr. Vikram Dalvi with us. Doctor, first of all, thank you so much for taking the time out, coming here and accepting our invitation. Thank you. So here now today, doctor's gonna shed some light on a very locally spoken topic, diabetes. Diabetes mellitus, diabetes, there are a lot of names. Now, I know a lot of us will have a little interest in this, considering most of us have at least one patient that's suffering from diabetes. And it's commonly said that diabetes cannot be treated or reversed. Is there really a treatment though? Is there really something that can reverse it? Let's find out. So doctor, when we say diabetes, first of all, what exactly is diabetes mellitus and how is it diagnosed?
Words exactly what they mean is diabetes mellitus is sweet urine. So this is how it was diagnosed in past, and how we diagnose it now is we check sugar in blood. If fasting is above 125, post meal is about 200, or there is a test called HbA1c, that is average sugar over previous 3 months. If it is above 6.5, we say that diabetes has been diagnosed.
Okay, doctor. And what are the types of diabetes?
Diabetes type 1, type 2, gestational and others. Type 1 is something that is usually diagnosed in very early life, say before age of 10 years, and that is when the pancreatic tissue that produces insulin is destroyed by antibodies. So it is kind of autoimmune disease, not very common, maybe about 5% patients of diabetes are type 1. Type 2 is what we see commonly, more than 90% of the patient that we see is type 2 diabetes, where there is no insulin deficiency initially as such, but the insulin doesn't work. Gestational is something that is found only in pregnancy. As soon as the pregnancy is over, the sugar settles down. That is called a gestational. And then there are multiple rare types, genetic disorders that can present with diabetes along with some other features.
Okay.
So commonest that we see is type 2.
Type 2. And doctor, what are the risk factors? How am I likely to develop diabetes?
The most strong risk factor, since type 2 consists, it gives us more than 90% of the patients, we'll talk mainly about type 2. That is what we can prevent, or that is what we can reverse. So the risk factor, one of the important risk factor is genetics, what your parents give you. If they are diabetic, you are likely to have diabetes. Second most important risk factor is obesity. If you have central obesity, that is waistline, that is second risk factor. Third is age. Fourth is lack of adequate physical activity. So these are main 4 risk factors for developing type 2 diabetes.
Okay. And doctor, of course, we all know that we have to be worried about diabetes if there is this fear of developing diabetes. But what exactly is the worry? What further can it lead to?
Diabetes equals high sugar is a very simple simplification of diabetes, but diabetes affects almost every organ of the body. So the commonest organs that are damaged are, one is your retina, that causes blindness, then your nerves, so you cannot stand properly or you cannot feel the things, then your kidneys get damaged. In fact, diabetes is one of the leading causes why patients land on dialysis machines. Then heart attack, paralytic attacks. In fact, these are relatively well known. What is not well known is patients are also prone to fractures, also more prone to cancers, and almost every tissue in the body is affected by long-term diabetes. It is the long-term complications that we worry about.
Okay. So doctor, now as I had mentioned about the cure, can it really be cured? Is there a cure for diabetes?
Cure as such is not defined, but what is possible is reversal in certain cases. So cure, no, it's not known as such, no.
But diabetes can be reversed.
Type 2 diabetes, yes, it can be reversed. Type 1, it is not possible. Gestational, it gets reversed just by delivery.
Okay. And doctor, which are these patients that have a realistic hope of reversing diabetes?
Okay. So if your diabetes is diagnosed well on time, if your diabetes is recent, less than 5 years of diabetes if you have, if you are obese, excess body weight, and if you are willing to put some efforts in losing weight, then you can reverse your diabetes.
And doctor, as you said about reversal, so once it's reversed or the patient is diabetes free, for how long can a person stay diabetes free?
That is still a topic of ongoing research, but a person can definitely remain free of diabetes at least for 5 years. Beyond that, it depends a lot on how much that patient or that person, now we cannot call that person as patient because he is now diabetes free. So that person, how long he keeps his lifestyle good, he maintains his body weight, that defines how long he is going to remain diabetes free. Ultimately, after a few years, it may come back. But you get very long period without diabetes.
Okay, doctor. And is this reversal procedure 100%?
No, it is not 100%. Not every person is going to get reversed with diabetes. About 50% patients, so half of them can reverse into normal sugars. So why everyone should try? That is very important. Because remaining 50% will definitely need much lesser medicines. And their sugar will be, even though it is in diabetic range, it will be still better controlled than those who are on medicines and those who are obese. So even if you cannot completely reverse diabetes as such, you are still managing your diabetes in a much better way. If you do the same thing, the treatment is same.
And doctor, how much will it cost a normal person? What will be the cost of it?
If you ask me, it costs zero amount of money. When you are a diabetic, you are anyway spending money on medicines, you are spending money on tests, you are spending money on doctor's visit, and you are spending money on dietitian. This is the exact same thing you are going to need in diabetes reversal. You need a doctor, you need a dietitian. In fact, where you are going to save is, you are going to, as you progress in the diabetes reversal program, you are going to need less and less number of medicines. So you are actually saving money rather than spending money.
Okay, and doctor, how can this be achieved?
Well, to say it simplistically, you have to lose weight. As simple as that. But losing weight is never simple. Secondly, when we say lose weight, it is general body weight that we think of, but our body is made of different tissues. So main tissues in our body are muscles, bones, fats, and various organs. Now, what causes diabetes is the fat around your liver, your kidneys, your heart, or around internal organs. So unless you reduce that fat, the diabetes is not going to get reversed. If you are losing weight but you are losing that weight in muscles, then it doesn't help. But if you are losing weight and losing that fat, then it causes reversal of diabetes.
And doctor, where can I measure this body fat?
If you don't have any machine, the simplest thing is to check your waist circumference. That is your circumference around the level of navel. If you maintain it below 80, this is in ladies, and 80 centimeters, and if you maintain it below 90 centimeters in gents, that means that you are having less of fat in the body. But there are certain machines which are available in leading gyms. Manipal also has a machine that gives you body fat percent. It tells you how much muscle you have, how much fat you have, and where is that fat distributed. Because we have fat almost everywhere in the body, right from brain right up to the toe. And what we need to worry about is the fat around the abdominal organs. So these machines tell us.
So doctor, how does diabetes affect your life?
Yeah. So this is a very important question. Most of the people think only of the cost that they have to spend on medicines. That is the simplest to understand. But medicines can make you poor by 500 rupees or maybe 10,000 rupees in a month. Well, that is the easiest part of it. Then you have to spend at least on 3 visits to your doctor and 3 visits to your dietitian. Plus you have to do multiple tests every year. For these visits, you are going to need 1 leave. So 3 leaves of your work are there lost. This is initial, say 4 or 5 or 6 years when the diabetes is uncomplicated. Once it starts getting complicated, the things really get very serious. Suppose this affects nerves of a driver. He cannot properly feel the clutch or the accelerator of his bus. So he loses his job, he cannot earn. Okay. Suppose this happens with a tailor. He cannot sew because he cannot see, his retina is gone. Suppose the patient lands on dialysis. Now dialysis is done 3 times a week. That person has to spend 6 hours in hospital. Along with that, a caretaker has to. So 2 people you are that persons are staying in hospital for 6 hours every alternate day. So that's a huge amount. Then once you are diabetic, your insurance, your life insurance or your mediclaim, the premium goes up. In fact, even if you take a life insurance initially 3 or 4 years, the companies say if you are ill, not life insurance, mediclaim, if you are ill because of diabetes related complications, we are not going to cover you. Okay. These days we are getting patients who are as young as 25 or 30 years who have been diagnosed with diabetes, and most of the girls with diabetes will have a disease called polycystic ovarian disease. So fertility is a problem. In males, the erectile dysfunction is a major problem. So those who are diabetic, these couples may not have kids, and then the social stigma also starts. So diabetes, the medicine is a small cost, other costs are very big. So that is why it is important to live life without medicine as far as possible. So what typical example I give is, suppose I develop diabetes at age of 30 years, I don't control it, I don't try to reverse it. By age of 45, I am going to be kind of debilitated. I will be on at least 10 medicines, I may have had a heart attack, I may be on dialysis, something else, I may not be able to earn. And that is when my child, which was born when I was 30-year-old, now he is around 10th standard or so. I have to spend for his education, I have to take him around, all that, I cannot enjoy my life with him. So that is why it is very important to reverse diabetes. The cost of diabetes is extremely huge. And this is something that can be in fact prevented. What we work on initially is prevention of diabetes who are at risk. If they develop diabetes, then try to reverse it. In fact, diabetes prevention and reversal, they go hand in hand. So that is one important part why we should try to reverse diabetes. There is one important thing, we are discussing diabetes reversal. Now diabetes reversal is, as I said, as simple as you need to lose weight. So when I tell my patients why you're not losing weight, they tell I do not get time to exercise. This is a big misconception. It is 80% of your diet and 20% of your exercise. You can lose weight even if you are not doing any kind of exercise whatsoever. It is whole and soul based on diet. So the studies that were done, how the diabetes was reversed. Usually, like I have measured my intake, food intake, I eat around 1800 to 2000 calories a day, which is my need. So I am maintaining my body weight. In diabetes reversal, the patients are given as low as 1000 calories a day or even lower than that. And that is when they can reverse diabetes. So you have to be extremely careful about what you're eating. And the simplest thing is, it is better to eat what your ancestors were eating rather than what your immediate parents were eating. So home food, less of carbohydrates, more of proteins and moderate fats. That is simplest thing to tell. These days the ready-made food, that is a biggest issue, including what is available as packaged food, as well as when you go to hotel, you usually tend to eat pizza. Now I myself love pizza. Where the pizza is the issue is not the cheese. The problem is the pizza base. That is the carbohydrate. So we have to teach children right from school time how to recognize what is carbohydrate, what is fat, and what is protein, and what they need more and what they need less. So that education about diet has to start right from the time of school. If you have to start from school, you have to teach their mothers first. So that thing has to start from ladies who start cooking. Many times patients tell me that I need to cook separately for myself. Actually, diabetic diet is nothing but something called as healthy diet. And all the family should eat something called as diabetic diet. In fact, my diabetic patients are allowed to have sugar in their tea. They are allowed. But they are not allowed to have maida, they are not allowed to have white rice, they are not allowed to have fruit juices. So that is something simple for diet. Regarding exercise, most of the people believe in walking. Now walking is something simplest you can do, but that is not actually enough. More helpful in diabetes is something called as weight training. If you can go to gym, if you have gym easily available, well and good. If not, simplest thing to do is just take a sack, haver sack, put some water in it, say 2 liters, 2 or 3 bottles, and climb the stairs. That gives excellent exercise for your muscles. and that is how you build your thigh muscles or glutes, and that is what is going to help in reversing diabetes. So that is about diet and exercise.
Okay, and doctor, what are the special diets for diabetic patients?
One of the most famous diets is called as keto diet. It is usually used for weight loss, and that is what we are trying to achieve in diabetics to reverse it. So if you think for diabetes reversal, keto diet is a very good option, but it has to be applied in a diabetic patient with some caveats. Now, keto diet is something which is very low in carbohydrates and high in fats and proteins. So it is supposed to cause something called as ketosis. It produces certain chemicals called ketones in blood, and that is how it works. In diabetes, there is another complication that can happen naturally. It is called ketoacidosis. So keto diet can be done in diabetics, but they have to be extremely cautious not to develop ketoacidosis. So if my patient says, okay, I want to do keto diet, I say yes, but there are certain conditions that you are going to have keto sticks, that is checking ketones in urine at home. Anytime you get a color beyond certain level, you have to call me. Now these patients, they need a lot of help, continuous, probably day to day also. So we give all the patients phone number which is available on WhatsApp as well as call, which is either with me or my assistant. So they have day to day touch with me. So these patients need a lot of this. Then there is something called as Atkins diet, which is quite close to keto diet. Other diets were tried. Very low carb, very high protein doesn't work. Very low fat diet also doesn't work. Usually the people that are scared of high fats, but actually for weight loss it is the carbohydrates that are the problems.
And doctor, what exactly is metabolic syndrome?
Metabolic syndrome is something, it's what you call conglomerate of certain signs and symptoms, which is high cholesterol level or high triglyceride level, high body weight, high uric acid, and most of the type 2 diabetic patients are going to have these features of metabolic syndrome. And if you have metabolic syndrome, that is an indicator that you are more likely to have heart attacks or paralytic attacks or something what we called as cardiovascular disease. So again, I come back to usual thinking of diabetes. Diabetes is high sugar, but diabetes is high sugar as well as high cholesterol and slightly high triglyceride. So if you treat only the sugar part, doesn't work. If you treat only the cholesterol part, doesn't work. You have to treat cholesterol as well as sugar. So many times patient will ask, why am I on cholesterol medicine? So we have to tell that diabetes is sugar plus cholesterol. We have to treat both. And if you try to reverse diabetes, you are reversing the cholesterol part also. You are reversing the polycystic ovarian syndrome also. In fact, a lot of patients these days come to us with something called as fatty liver. They get some abdominal pain, they go to ultrasound sonologist, they do check their liver, it says grade 1 fatty liver, grade 2 fatty liver. That is also reversed by weight loss or diabetes reversal. So once you are treating the metabolic syndrome or excess body weight, body fat, then you are treating diabetes, high cholesterol, fatty liver, uric acid. These all are treated by one simple method of weight loss.
So doctor, how can fat cause diabetes?
Yeah. So see, fat is an important component of our body. It is needed in almost each and every tissue. The most important is of course brain. Brain is made of fat. Now the fat that we worry about is distributed all over the body. There is some fat under the skin that supports our skin. That is not dangerous. The dangerous part is the one that is around the organs, the liver, kidneys or the heart. Now many times we think that fat is just collection of fat globules or fat cells. They are just deposits of energy, nothing else. But this fat tissue is actually metabolically very active. Now fat is supposed to produce certain chemicals or hormones. Two names I can tell you is leptin and adiponectin, and they mainly work on your brain and various other metabolic parameters. So this fat which is around the organs, it produces certain chemicals. One of them I told you, that causes something called as insulin resistance. So what insulin resistance means is insulin is there, your pancreas is producing insulin, but it is not able to work in the target organ, say liver or the muscles or any other tissue. So what does insulin do exactly? There is a lot of sugar. Suppose there is sugar in blood that has to go into the cells to produce energy. So insulin allows cells to absorb that glucose from blood. So if insulin is not there, like type 1 diabetes, the sugar cannot go into the cells. In type 2 diabetes, insulin is there, but there is resistance from the cell. So even then the sugar cannot go inside. So once we reduce this fat, extra fat which is around the organs, these toxic metabolites or hormones, they automatically come down, and that is how your insulin starts working well. In fact, in type 2 diabetes, even before they develop diabetes, there are certain signs that we detect on OPD basis that tells us that this patient is going to develop diabetes. Those signs are blackening of the skin around the neck, or they develop small skin tags, you will find them, or blackening of the skin in the armpits. They are called as acanthosis. So if such a patient comes, he may come for something, leg pain or something else, but if I find that he has that neck sign and he is slightly obese, I have to tell him that you are going to develop diabetes in next 5 years if you don't take care. So these are the signs of insulin resistance. So once we treat this fat which is around the organs by causing weight loss, these signs also reverse. So this is how fat causes, by secreting certain chemicals, it doesn't allow insulin to work.
This was actually some important knowledge, because until now I really wasn't aware that diabetes could be reversed. There was a procedure. So I really hope this helps our viewers understand better. Maybe from now onwards they can start monitoring their weight. They can
Correct.
come to you. Thank you so much for all your help, doctor. So if any of you wish to consult Dr. Vikram Dalvi, he's available at Manipal hospitals from Wednesdays till Mondays. He's available on Sundays as well if you wish to consult him. Also, Manipal Hospitals offers a package, a tailor-made package for diabetic patients, especially with blood tests, retinal examination and foot examination. See you again soon. Until then, eat healthy, drink plenty of water, exercise sufficiently and take care.